All right. Well, again, hello, everyone. Happy Saturday. Thanks for joining me for this Graves and Hashimoto's Q&A call. And, if you have a non-autoimmune thyroid condition, that's fine as well. I'm here to answer questions. And so before we get started, and feel free to let me know where you're Zooming from or where you're tuning in from on Facebook. And let me just grab my water bottle back here. And I'm for those who don't know, I'm right outside of Charlotte, North Carolina. I'm in Matthews, North Carolina. And it's a very nice day in the 70s and sunny today. So might get some sun after this. But let's actually, I got to still prepare for the challenge, still not completely prepared. So let's go, and I'll give just give a couple of announcements. All right, so hopefully everybody has checked out my podcast. And if not, you can do so, savemythyroid.com. And so just to let you know, most of the solo episodes, I'd say probably like 80% of the solo episodes focus on hyperthyroidism. Reason is just because there are a number of thyroid podcasts out there, but most of them focus more on Hashimoto's, hypothyroidism and Hashimoto. So this one is the opposite, focuses more on hyperthyroidism. However, some solo episodes, like the last solo episode was on histamine, which benefited anybody really with not really, I would say just even those who might not have a thyroid condition, but obviously targeted towards those with hyper or hypothyroidism. Whereas this episode that's coming up Tuesday will be on exercise, but there's really going to be a focus on exercise and hyperthyroidism. Now, the guest interviews, most of the guest interviews will benefit both people with hyperthyroidism as well as those with Hashimoto. So if you're attending and if you have hyperthyroidism, pretty much all the episodes will benefit you. And whereas if you have Hashimoto's, then you might want to stick mostly with the guest interviews, although there is overlap with even the solo episodes. Like, for example, this Tuesday, again, focusing on hyperthyroidism and exercise, but some of the information can benefit those with Hashimoto's as well. And then I kind of slipped in the beginning, mentioned I have to work on the challenge. I announced it actually yesterday. I did a Facebook Live, but haven't mentioned anything here today. So next Monday, May 9th, I will be having a free 5-day accelerated thyroid healing challenge. And this is the third time I'm doing this. I typically do it once a year. I did one in August of 2020, and then last May of 2021, and now May of 2022. We'll be having this for the third time. And if you want to register, you can visit this website, rapidthyroidhealing.com. And the way it works is pretty much every day there. So next Monday through that Friday, you will receive early in the morning, my time, like 6 a.m. Eastern time, my time, there'll be an email sent out and I'll have a pre-recorded lesson. So you could watch it pretty much anytime at your convenience that day or during the challenge. And then I have live calls daily. So Monday through Thursday, I give a live call on a certain topic. And then on that Friday, which I believe is Friday the 13th, May 13th, I have 2 live Q&A sessions, kind of similar to here, what we're doing here. But by then, the goal is to have, not that we won't have questions here, but the questions there hopefully will kind of relate to the challenge, people going through the 5 lessons and hopefully have some questions. And then that Saturday, I plan on having a bonus lesson or bonus live session, not a bonus lesson. There'll be 5 pre-recorded lessons and then 5 live sessions, but again, really like 6 live sessions. So yeah, that's pretty much how it goes. And everything is explained when you register, or even if you don't register and you just visit the website, rapidthyroidhealing.com. And so if you do register, you'll get a welcome email. And then also it will encourage you. Well, you'll get a welcome email, but also you'll get a thank you page, and then it'll talk about the Facebook group. So you don't have to be on Facebook to participate in the challenge. It's perfectly fine just to watch the lessons, and you get the live calls will be on Zoom. I should mention that. And I might live stream it to Facebook. I've just had problems recently, so it might just be on Zoom. So you definitely don't need to be on Facebook to participate in the challenge, but I do some extra things in the Facebook. There's some engagement, first of all, but then, I have like a contest where people answer a question of the day and they have to answer it in the Facebook group. So yeah, just otherwise though, you don't have to join the Facebook group. And I have two Facebook groups. So the link is to my Graves and Hashimoto's Facebook group. And there's about 5,000, over now, I think like 5,500 people in that group, but not everybody who's in the group will be participating in the challenge. Probably a few hundred people, if the last few years are any indication, anywhere from probably I'd say 300 to 500, just because I don't expect the first 2020, when I first had it, we had over 1,000 people. And then last year, I think it was like 800. So I'm guessing it'll probably drop to maybe like 500-600 this year, just because those who have attended in the past might choose not to attend. Okay, so that's pretty much all the announcements. So let's go ahead and see what questions people have, or again, if you want to let me know where you're Zooming from. And I need to remember to go back and forth between YouTube. And so we have, I think, one question so far on YouTube. So go back and forth between YouTube and Zoom. So I'm going to start with Zoom, and then we'll go to YouTube. And okay, Lori is attending from Rhode Island. And let's see, Sarah Jane from Nova Scotia. Let's see, okay. All right, so Laurie, with the first question of the day, is black seed cumin oil good for Graves' disease? So black seed, so black cumin, black seed, black cumin oil, it has a lot of different benefits. There's no research specifically talking about Graves. There actually is research for hypothyroidism. I think it might be Hashimoto's. I wrote an article, so I forget if it's hypo or Hashimoto's, but it's not like it lowers thyroid hormone level, or it's not like it increases thyroid hormone levels. It seems like it's acting more on the immune system. So I think it's fine for people with hyperthyroidism, Graves' disease to take. And when I give it, commonly I'll give it, it's also can help with H. pylori, and a lot of people with hyperthyroidism Graves have H. pylori, and it doesn't seem to cause a problem. And I bring that up again because the research is more on hypo or Hashimoto's, but it's really good for inflammation. So it is one of those things where I've thought about, is it something I should give across the board, where I should give to everybody? I did write a blog post in September. I think it was September 2020, in fall of 2020, about actually helping with COVID. So there's some research also that black cumin oil, black cumin can help with COVID. And even though I will say I got hit hard with COVID in January, and I was taking black cumin at the time. So I don't know how much it helped. Maybe it would have been worse. I didn't have to get hospitalized. It wasn't that bad. So who knows, maybe it would have got into that if I didn't take it. I'm not sure, but I do like it a lot. There is a good amount of research, and it does seem to be well tolerated. So Sarah Jane, do you link any facial signs to thyroid conditions? Other than thyroid eye disease, not really. If someone has, thyroid eye disease symptoms, we can almost definitely conclude, like in the presence of hyperthyroidism. If someone has hyperthyroidism and they're also, and not everybody with thyroid eye disease has hyperthyroidism, but typically if someone has hyperthyroidism and they have thyroid eye disease, then you could typically say the person has Graves. But even if they don't have hyperthyroidism, let's say if someone just doesn't get diagnosed with hyperthyroidism and you see the bulging of the eyes, for example, which doesn't always happen even with thyroid eye disease, but then you could kind of say, well, looks like thyroid eye disease. It depends on the person. Most people probably wouldn't come to that conclusion because a lot of people aren't familiar with thyroid eye disease. But other than that, I wouldn't say there's like any common facial signs where you could link to, hyperthyroidism or hypothyroidism. So can you talk about supplements like selenium and zinc for people with autoimmune thyroid conditions? Actually, I won't talk about selenium because that's my latest episode on the podcast. So if you don't like listening to podcasts on your phone, visit savemythyroid.com and that you'll see the most recent episode. I just released it 2 days ago and it's entitled, I think it's Selenium and Thyroid Autoimmunity. And, it's based on a question, about selenium, whether or not it could benefit people with autoimmune thyroid conditions. So in short, I'll say yes. Selenium, I'm definitely a fan of, and it's not a long episode. It's like 5 minutes. So I would tune in to that episode. And then zinc. It's not just autoimmune. I mean, zinc is very important for immune system in general, and so I can't say I recommend zinc for the autoimmune response. Selenium, I would say, is more for that, just because there is evidence with selenium lower thyroid antibodies. And I don't think there's really evidence with zinc doing that, but just very important for optimal immune system health, plays a role in wound healing. And so both of them, I mean, all minerals, all nutrients are essential, but selenium definitely one of the more important ones, and zinc also very important. Oh, we got Heather joining from Missouri. Thank you so much for offering your time. You're welcome. Thank you. Thank you and everybody else for attending on a Saturday afternoon, or at least where I am. I know Missouri, obviously it's a Saturday afternoon, an hour earlier, so Central Time, but, some people might be, actually, you know what? Hold on just a sec. Okay. I realized you could probably hear me, but my computer was on mute. So for any reason there was anything in the background playing, I would not hear it. So, but anyway, for those who are attending in a different, like if you're overseas, like in Europe, and it's, in the evening, again, thank you for attending, or those in the West Coast where it's still, in the morning, again, thanks everyone for attending. And, so I just developed Graves in February this year after a bout with 3 back-to-back viruses, the last one COVID, and which I also have an episode on COVID too, more specific to hyperthyroidism, even though I think I might speak about Hashimoto study in there, but most of this research that I bring up is related to hyperthyroidism. So let's see, my free T4 is 6.35, which is elevated. T3, definitely high, greater than 350. Total T4, 18.2, which is high. TSH, not surprisingly, 0.01. CPO, 160. And then liver enzymes on the higher side, especially that ALT is 93, AST 46. ALT is I won't say, I mean, I've seen higher than that, but 93, I don't like when I see it that high. Creatinine high. Sure, creatinine usually a 0.6 usually isn't high. If anything, that's usually on the lower side. So I don't know. I mean, every lab's different, but creatinine, that's usually not a high creatinine. Usually it's like above 1 when it's high, or some labs like 1.1, 1.2. Anyway, so I've been diagnosed with Graves' disease, and my endocrinologist won't let me do methimazole due to elevated liver enzymes, and it's pushed for me to get radioactive iodine. I'm not interested in going that route with my thyroid levels, so I still have an option to go the natural route. I have Bugleweed coming in the mail. Any suggestions on how to move forward to save my thyroid? And so I think, so it sounds like you're not on methimazole, that your liver enzymes are just high, just with maybe everything else going on. Sometimes hyperthyroidism itself will cause the liver enzymes to be elevated. I mean, first of all, I don't agree with the endocrinologist, because the anti-thyroid medication, it definitely can increase liver enzymes and commonly does, but it doesn't in everyone. I could understand the concern though. So even though it's like, I disagree, everything's risk versus benefit. So that's why I disagree. It's not that I disagree being cautious about the medication, but it's like, like the alternatives in the endocrinology world are radioactive iodine thyroid surgery. So they won't be thinking about alternative strategies. So, I would still say if I was a conservative endocrinologist, I think I would say, well, it might be worth giving a try and then just monitoring those liver enzymes, maybe every week or two, do a panel just to see what, the liver enzymes look like. Because, methimazole doesn't always. And when it does, it's not crazy high. Now, you can make the argument, well, ALT is already 93. So even if it goes like to 103, that's still high. But by comparison, like hepatitis, you a lot of times see liver enzymes in the hundreds. So I mean, this indicates it's doing damage to the liver, but the liver is very quick to regenerate. And again, it's risk versus benefits. I'm not making light of it, but if I had a, if I was in a situation, it's like, okay, it's like killing off cells in my liver, but they are, it's not crazy high where it's, chances are it's not going to do like extensive liver damage or cause liver failure. So, and I definitely would want to do everything I can to preserve the health of my thyroid gland, to save my thyroid. And so again, I wouldn't be opposed as a patient to take the methimazole in this situation. Now, of course, with my background, that wouldn't be my first choice. My first choice would be the bugleweed, because that's what I did in the past. And so I would try the bugleweed. And I mean, I can't give specific dosing instructions just because everybody's different. And it's not only that, it's just, again, I do that to patients, but not to just like people in general. But what I will say is it depends on the extract ratio. So like the one I use is on back order for a few months. So you probably don't have that, which is a 1 to 2 extract. So it's probably anywhere from like 1 to 3 to 1 to 5. So if it's like 1 to 3, like Hawaii Farm, I'm using now, just because the one I usually use again is on back order. And Hawaii Farm, if someone has like your numbers, your numbers are pretty high, like 6.35 is pretty high free T4. Obviously the total T3 is undetectable, greater than 350. So in this situation, if you were my patient, I would probably say take like a teaspoon and a half, like 3 times a day. And let's hope that it works, because bugleweed works about 70% of the time, I would say, but that's 25-30% of the time that it doesn't work. So if it works, great. Definitely you want to keep an eye on the thyroid panel. And I wouldn't expect it to normalize after a month, even a couple of months, but hopefully heading in the right direction. If that doesn't work, I mean, there's L-carnitine in higher doses, like 2,000 to 4,000 milligrams in the research. I find bugleweed to be more effective, but L-carnitine is an option. Lithium orotate is an option, or lithium carbonate, but you'd have to get a prescription for that, and most medical doctors won't do that. I do have an article and a podcast episode where I talk about cholestyramine. So if you visit naturalendocrinesolutions.com, my main website where I have like the articles, savemythyroid.com, which is on the slide here. That's where my podcast is hosted. But naturalendocrinesolutions.com, cholestyramine. I could actually type that also in the chat. I think I'm spelling it right. Cholestyramine. Hopefully I'm spelling it right. Yeah, I'm not sure actually if I'm spelling it right, but if you do a search engine search, it'll come up. It'll autocorrect, especially Google, even though I don't love Google if you type that in. But cholestyramine, also on my website, my podcast episodes 2 and 3, I talk about conventional and natural treatment options. So I would tune into that, because again, if you can't, you gotta, and also there's a podcast episode that's more recent, like what to do if bugleweed's not effective. So not to think negatively, but you always want to have a backup plan in case if the bugleweed doesn't work. So, but yeah, I would be with you. I'd be like, okay, I'm concerned about my numbers and the liver enzymes, and and also, so supporting the liver not a bad idea, especially with the liver enzymes this high. So things like, I might recommend like N-acetylcysteine or NAC, silymarin, or, which is milk thistle. And then, I've been doing, I'm getting interviewed for a mitochondrial summit. So mitochondria, the energy powerhouses in the cell. And so one of the research studies I've come across is the impact of methimazole on the liver cells, which I know you're not taking methimazole, but it's interesting. It was saying that it affects the liver cells that are mitochondria. And there's another study that shows that taurine, which is an amino acid, might help to mitigate that damage to the liver enzyme when someone's taking methimazole. So that's, I guess, a few things to consider is if even without taking methimazole, taking taurine. And again, I didn't do the conversion. I think they use like 200 micrograms, but it was a rat study. It wasn't a human study. So I'm not sure what the equivalent would be. And, what I would say, if someone's going to do it, maybe just take until I get the conversion done, which I don't know when it'll be, but maybe just taking whatever the recommended dosage is. And then, if you do end up, finding another endocrinologist, if you like switch endocrinologists, and they are open to doing the methimazole, then that's something to keep in mind too, that taurine might help. But I'm thinking also other things like NAC or liposomal glutathione or milk thistle can also help as well. But it was interesting to see that study. All right, so I am going to go to YouTube. And oh, wow, there's like a lot of questions on YouTube that didn't expect. Yeah. Usually with YouTube, when I do these Zoom YouTube calls, there's a lot of times not a lot of activity on YouTube. So, so let's see. I'm going to answer a few on YouTube. I'm going to go back and forth between YouTube and the podcast. Not YouTube and the podcast, YouTube and Zoom. And I'm going to stay on until probably like 3. Definitely stay on at least until 3. I'm willing to stay on until 3:15. Remember, if your questions aren't all answered, next week I'll have the accelerated thyroid healing challenge, as you can see on the screen, and it's for anyone pretty much with Graves, Hashimoto's, but even those with non-autoimmune thyroid conditions. So my goal during that week is to really answer all of your burning questions and to teach some great information to help speed up your thyroid healing. So again, rapidthyroidhealing.com. And then Sandra has a question. If you're taking methimazole and your labs are within the normal range, how do you know if it's okay to stop the meds? What you want, this is the same with bugleweed. When taking antithyroid medication or any antithyroid agents, you want the numbers to be more on the hypo side. So when that TSH is not the most important marker, but it's important when it comes to dosing and like really weaning off like again, antithyroid medication or antithyroid herbs such as bugleweed. So if TSH gets to let's say over 2 or over 3, which is still within most lab ranges, but then it's kind of pushing towards the hypo side, that's a sign that it's time for the prescribing doctor to reduce the dose of methimazole. So if someone is taking 20 milligrams of methimazole, which is kind of like a medium dosage, but let's say their TSH is like 2.6, and so it might be a good idea to reduce that to or again to have the prescribing doctor reduce it to 15 milligrams, maybe even 10 milligrams, depends on the person, or depends on the thyroid hormone levels. So it really depends on the doctor, how conservative they are. But yeah, so that's what you want to kind of see. You want if someone takes methimazole and they don't need it, if someone takes any type of antithyroid agent and they don't need it, their number should push more towards a hypo side. So that's what you're kind of looking for. Okay, so Lorelei says, I have Graves' disease since 2009, not taking any medicine since 2011. Oh, yeah, Graves' disease since 2009, not taking it since developed retinal thrombosis last year. Yeah, I don't have any experience with retinal thrombosis. I mean, I have a lot of experience with thyroid eye disease, but yeah, I mean, and also I don't know, like, you're not taking medication. Have you been hyperthyroid for like the last 11 years? or have you just been, has everything been okay since 2011? So that's another thing too, because you don't want unmanaged hyperthyroidism. That's important to do something, whether it's taking the natural agents such as bugleweed or L-carnitine, or if you have to take the antithyroid medication. But obviously you want to also do things to address the cause of the problem. And that's the thing. Some people will get into, so-called remission, which actually this would have been a long time, but like to be in an 11, like if you didn't do anything for the cause, but and I'm not sure if that's the situation, but yeah, I would see an ophthalmologist for this, the retinal thrombosis. I can't say this is something I commonly deal with in, with my practice. Okay, so Jaffe says, listening from the UK. Oh, and Julie, I'm sorry. Okay, so Julie is your name. Hey, Julie. And Walt is from North Carolina as well. Okay, Lorelei is hearing from Italy. Well, thank you for attending from Italy. And let's answer a few questions here, and then we'll go back to Zoom. So Walt says, read Hashimoto's triggers and several other references on Hashimoto's. Not sure what source, but read that Hashimoto's developed due to prolonged exposure to estrogen. Your opinion? Yeah, well, thank you for reading my book, Hashimoto's Triggers. I appreciate that. And I do talk about estrogen in a book, but I don't think like that. I know that's not like the only factor that I talk about, because again, it's a pretty comprehensive book, and that's the purpose of my Hashimoto's Triggers book, is to talk about different, really just about all the different triggers, very comprehensive. And yeah, so yeah, my next book, by the way, hopefully 2023. I'm actually working on it, and hopefully it'll be another one on hyperthyroidism. So I have one that I wrote 2011, revised it in 2013 on hyperthyroidism and Graves, and then 2018 I had a burning desire to write a book on Hashimoto's, and I'm very, very proud of that book. But definitely want to write another hyperthyroid book. So there'll be one next. Again, I'm hoping next year. No guarantees, but I'm working hard to get that done. And yeah, so but yeah, estrogen could be a factor. Prolonged estrogen, I mean, which a lot of people like the xenoestrogens, especially, if someone's drinking bottled water on a regular basis, that could be a factor when it's an endocrine disruptor, but also has impact on the immune system. So, but again, I can't say that all cases of I don't think anybody could say that for sure. They could give their opinion and say that's the main reason. But yeah, I would definitely say it is a reason. And then Demon says, I'm in Liverpool, United Kingdom. I've had huge improvements in my Graves since cutting out gluten, dairy, nuts, and some nightshades. Would recommend that I also explore other things like peptides and supplements. And then PS, my success so far is due to your teachings. So thanks for all that you do. Well, thank you. Thanks. I appreciate that. And yeah, yeah, I mean, it's great that you're doing things from a diet perspective, but I commonly say that diet is just a piece of the puzzle. Now, peptides I'm kind of new to. So I did release, there's a interview I did with Dr. Anshul Gupta, and it's actually been on my podcast for a little bit, maybe like a month and a half, 2 months. But then I released it here. I released it today on YouTube and sent out an email. And we spoke about triggers, but also he spoke about peptides. So he's definitely the peptide expert. So I mean, it sounds really good. I don't know if that would be where I start with as far as peptides, and that might change in the future. But doing other things like, I evaluate adrenals in my patients, doing things to reduce your toxic load. Hopefully you're doing that currently. But so yeah, I would say most of the time we don't want to just do things from a diet perspective, but it is a great place to start. And yeah, like I said, the peptides, still learning about them. So it's not, I don't even know if with, Dr. Gupta, if he recommends it to every single person. He focuses on Hashimoto's. And actually, if you visit the YouTube link, or again, that I sent an email out, for those with Hashimoto's, there's a Hashimoto summit coming up. And I'm actually a guest speaker with that as well. So even though my focus more has been over the last year or two, hyperthyroidism Graves, but he asked me to talk about it, and I told him I would. So yeah, check that out. All right, I'm going to go to Zoom. I know there's more questions on YouTube, but there's also people on Zoom with questions. Again, I'm going to go back and forth, and I'm going to take a quick sip of water here. So Lori asked, how important is exercise with Graves' disease? All right, I could see cholestyramine. I think I left out an E now that I'm looking at it. So I think it's CHOLE. Yeah, that doesn't look right. Might be, and I think I'm maybe an extra Y. Maybe where the first Y is, there should be an E. I should know how to spell it, but sometimes I have to cheat. So and I didn't cheat here. So exercise with Graves' disease. Again, tune into the podcast episode for Tuesday if you're interested in that. But I will say, you don't want to go crazy. You don't want to, I mean, movement is a real good idea. It's not the priority isn't exercise with Graves. Let's put it that way. You want to be, I'd rather someone be more conservative than overdoing it. So usually I would say, like, don't do things like high intensity interval training, maybe do some light walking. Weight bearing exercises is a very good idea to do because that'll help with the muscle mass, which a lot of times is a factor with hyperthyroidism, also bone density to some extent. So yeah, Tuesday, so less than 72 hours it'll be posted. The episode is pretty much ready. I just need to almost ready. Actually, it's not 100% ready, but it'll be ready by tomorrow. I just don't, just like most podcasters, we post it on a regular schedule, just way people kind of know when to expect it. And so yeah, just tune in on Tuesday. And let's see. So Heather and Sarah Jane, you are welcome. So Heather says, I would much rather take the bugleweed. I'm grateful to hear that it's still an option with my high thyroid levels. I'm scared of having a thyroid storm and trying to avoid. I have a 1-to-3 ratio from Hawaii Farm. I just bought some L-carnitine yesterday to try too. I'm ready to tackle this in every way I can. Thank you so much for your help. Yeah, I should say, Heather, I mean, again, there are risks. I don't want to say that there's absolutely no risk because your thyroid levels are high. It's just risk versus benefits. And I mean, so what I would say, again, that the bugleweed is worth a try. Again, yeah, there's concern because I don't want to mislead you and think, oh, everything's fine and dandy, and I could take the, bugleweed and I don't have to worry about a thyroid storm or anything else. I mean, there is that concern. I guess with me putting myself in that position, I would want to do everything to avoid radioactive iodine thyroid surgery, but I also would want to be safe. So, I'd be hoping the bugleweed works. But another thing to consider too, which I don't know if your endocrinologist brought up, maybe your primary care would be open to it. And again, I'm not a big fan of what I'm about to say, but beta blockers such as propranolol will affect conversion of T4 to T3. So I don't like beta blockers, but again, yeah, I can't say there's no concern. And with the beta blocker, it very well might, like, depending on the beta blocker, propranolol is the most commonly given because it also affects that conversion process. So it might help with that T3, which is we don't know how high it is just because it's greater than 350. So yeah, I just wanted to, okay, you are on the propranolol beta blocker. Okay, yeah. So yeah. So again, I would, like I said, I don't want to, my goal is to save people's thyroid glands, but I don't want them to end up in the ER with the thyroid storm. So I'm glad you brought that up because again, there's no, yeah, so you're doing something. It has helped a lot, but my levels did double since getting on it. Oh, wow. Okay. So it didn't really help to lower the levels. Yeah. And, the T4, it's not going to help at all because it's not really anti-thyroid properties. It's just helping with that conversion, but I'm surprised it didn't help with the T3. So, but yeah, like I said, I would, the bugleweed I think is worth a try. I've seen it work in cases where it's really high. And, but again, I've seen it not work in cases where it's really high. I've seen it work in cases where the levels are not too high. So like I said, bugleweed, in my opinion, worth a try. You got the L-carnitine. And yeah, so I would recheck the T3 because yeah, propranolol is not going to affect the T4. It would just, methimazole affects the T4 and the T3. But like I said too, I like, if in your situation, like that's another thing. If I took the bugleweed and if it wasn't effective, I mean, definitely check out my podcast episodes. But I might try to find an endocrinologist that would prescribe the methimazole and say, hey, I'm just willing to, I know there's a risk, but it's there's also a risk with radioactive iodine thyroid surgery, and there's a chance that the methimazole won't elevate the thyroid hormone level or elevate the liver enzymes any further. So. All right, so Natalie with a question. I was diagnosed with Graves 6 months ago. I took methimazole for a month and my T3, free T4 are back to normal range, but fluctuate. I'm on a strict AIP diet and limit iodine intake for 2 months now. I'm not taking medicine for a month. My free T3, my T3, free T4 are swung around mid-normal ranges and TSH is 0.03. What vitamins, supplements, and herbs should I take so that I won't be deficient on nutrients and stabilize T3, free T4 levels? If I don't limit iodine intake, my free T3, free T4 will increase quickly. So yeah, everybody responds differently to iodine. So listen to your body, and yeah, low iodine. I'm not against iodine. I had in the past I had a good experience with iodine, but some people definitely do better with a low iodine diet. There's actually a book on that out called The Thyroid Reset Diet by Dr. Alan Christensen, where he encourages really everybody with thyroid or autoimmune thyroid condition to, have a low iodine diet. Again, I can't say it's that everybody needs to do that, but again, I also am cautious about iodine too. So I wouldn't say like to go out and eat a lot of iodine. I actually had an interview yesterday, and I'll get to your other question about the supplements, but I had an interview that wasn't on Facebook where we would talk about autoimmune paleo, and I asked the person about sea vegetables because they're high in iodine, and I've been cautious about giving sea vegetables, recommending sea vegetables, but she works with she's not exclusively working with Hashimoto's patients. She doesn't really work with Graves. It seems that's the way it goes. Most functional medicine practitioners, they work with Hashimoto's patients and not with Graves, just because there's more people with Hashimoto's and they're kind of nervous about working with people with Graves. But what was I going to say? So, oh yeah, so she said she's fine. She recommends sea vegetables to people with Hashimoto's and doesn't seem to see any problems with that. But yeah. Anyway, I'm just bringing that up just because when I talk about iodine, there's typically two types of people. So there'll be people here that are like scared to death of iodine and want to do everything to like not take any iodine, which I understand. But then there's others who will be the opposite, and they might read Dr. Brownstein's work or something, where they're thinking about taking higher doses of iodine, which I don't recommend that. I don't recommend like taking real high doses of iodine. But yeah, I think, yeah, anyway, so that'll be a future podcast episode where I go into more into iodine. But and I do have some articles on that on naturalendocrinSolutions.com. But so vitamins, supplements, and herbs. So remember, I can't give specific information like to you. I can't say this is what you need to take. Everybody's different, but I would say like, for patients, I almost always recommend omega-3 fatty acids, but you could also do a test. There's companies like Omega Quant where you could do a fatty acid panel for less than $100. And most people, unless they're eating fish like almost every day, most people are deficient in omega-3s. Vitamin D is something I have everybody test for. Most people are deficient in vitamin D. I mentioned selenium earlier and zinc. And, so, I mean, there's some, yeah, someone could be deficient in pretty much any nutrients, but, and I won't say to take each one individually. One can make the argument taking like a higher potency multivitamin while one is trying to improve their health might be a good idea. And herbs also depends on the person, like the, bugleweed I took and motherwort I took. for more for a symptom management aspect. But also got to think about gut health. If someone is deficient, the health of the gut, you want to make sure you're absorbing the nutrients as well. And yeah, so that's it. Let me make sure just everything is going okay, just because I'm not getting any, haven't had any new, well, maybe in YouTube I've got a new question. So far none in Zoom. So just want to make sure I didn't freeze. If there's any other questions in YouTube, let me know. I mean, in Zoom, let me know. I'm going to go in a minute to the YouTube chat, because again, there's some new questions there. But yeah, well, yeah, as far as, not as far as supplement for gut health, also I'll say, I love supplements, I do like them a lot, but I would also make sure, like, don't just take supplements for everything. So like gut health, if you're not a vegetarian, drink some bone broth, maybe, or cabbage juice if you are a vegan vegetarian. Fermented foods really good for gut health. Probiotic supplements are good for gut health, as long as someone can tolerate them and they don't have a condition where, like, where they'll get a lot of bloating gas. And L-glutamine is really good for supporting the gut. Someone has like an increase in intestinal permeability, which is a leaky gut. So yeah, so those are, and digestive enzymes I commonly give as well. But yeah, check out, again, tune in, Natalie, check out my podcast and my website, naturalendocrinesolutions.com, for my articles, savemythyroid.com. I do have at least one podcast episode where I know I chatted with Dr. Weston Childs. Actually, that was the last episode. The histamine was the one before, but last week was unwanted weight gain in some cases of hyperthyroidism, as well as Hashimoto's. But then we had an early episode where we spoke about supplements. And Heather, I'm going to get to your question in just a few minutes. I'm going to, just to be fair, go back to the YouTube channel and just answer a few questions there. Taking a quick sip of water again. And just a reminder, I'm going to have another one of these on Thursday. This Thursday, when is that? That's May 5th, right? Cinco de Mayo. May 5th at 8 p.m. Eastern time. Figure I would do one now, at this time, and then one different time to accommodate those in different time zones. All right, so Thank Ace here says, my wife has taken both methimazole 15 milligrams and propranolol 20 milligrams, and also starting bugleweed, lemon balm, and motherwort, and L-carnitine. Goal is to stop taking meds and transition to a natural path. But what heart rate should she stop taking propranolol? Well, again, keep in mind, I can't tell. Again, I get questions all the time, but I can't tell anyone to, like, when to stop taking something. That's really up to, I know you're trying to do it on your own, or it sounds like, taking the herbs, or your wife taking, all the natural agents, and then you want to kind of just see on your own. Again, think about, with all these things, what should your heart rate be without the propranolol? It should be, low 70s, low seven, if everything's normal, low 70s, or mine is in the 60s. So if someone is taking the beta blocker and they don't need it, then it should get, like, what's your average, or what's your wife's average? If her resting heart rate's average is 70, and if the beta blocker is doing its job, then maybe it's down to, 60 or 65. And that'll give a hint, okay, maybe she's, doesn't need as much propranolol. And then maybe the prescribing doctor could decrease it by 5 milligrams, for example. Again, and that's, like you said, stop taking it. That's another thing too. Like, with all these, I would never say just stop taking it. Even if I could say it, I wouldn't say stop taking the methimazole or beta, propranolol, the beta blocker. Same thing with bugleweed. It's not like everything looks good, so let's stop it. We decrease dose slowly and see how someone's doing. And I know that's not what people want to hear. They want to say, okay, I'm taking the natural stuff, when can I, stop taking whatever completely. Again, maybe someone could decrease the dosing quicker if they're taking all these natural agents and if they're on the hypo side. But yeah, so all right, and Walt, yeah, that with the extremely comprehensive, yeah, but he was talking about my book, Hashimoto's Triggers. Yeah, it's, again, that's probably going to be the only book I put together on Hashimoto's. My goal is, again, to focus more on hyperthyroidism, I mean, two reasons. One, that's my background, is I dealt with Graves personally, but just there's not a lot. The second reason, and the main reason, there's not a lot of resources out there. So when I wrote the Hashimoto's Triggers book, I'm like, I'm gonna, not that I didn't go all out with the first one on hyperthyroidism, but with that one, honestly, I was trying to get something out. I wanted to get a book out on hyperthyroidism, and I could have kept on writing like with that, but I wanted to get something out. So the first edition, definitely the second edition is better than the first edition. But if I had to rewrite the second edition, I'm sure there'd be a lot of changes, and maybe eventually I'll do that. But it's going to be a new book next year, not a revision. But with Hashimoto's, I went all, I'm like, you know what, I'm just going to go all out. And unfortunately, it took a long time, for it to come out, and like a few years after I thought it would. I don't think that'll be the case with the hyperthyroid book, just because the next hyperthyroid book is not going to be like 500 or 600 pages like Hashimoto's Triggers, because I plan on coming out with a few different hyperthyroid books over the next few years. So my goal is not to put everything in one book. So again, I want to get it out and not wait until, what is it, 2022 now. If I take the same approach with Hashimoto's Triggers, I won't get it out probably until like 2025. So my goal is to, get out different, books on different topics related to hyperthyroidism. There might be one or two that will benefit both people with hyperthyroidism and hypothyroidism, Hashimoto's. But I probably won't write a dedicated book on Hashimoto's again, is my guess. Things could change. You never know. Maybe 5-10 years down the road that could change. But all right. And D-Man says, Fab, thanks. I did watch that peptide video today. Okay, cool. That's why, yeah, it makes sense. That's why you're asking. Yeah, I found it very interesting. Again, Dr. Anshul Gupta on my podcast and YouTube channel, we spoke about peptides, which could be beneficial. I mean, it's I just still learning about that. So definitely check out that video. So Deborah says, I have Hashimoto's. What can I take with antidepressants to help this? I'm only on T4 and can't take T3 meds. My TPO is high, thanks. I don't convert to T3, and propranolol makes me dizzy. Well, propranolol, as I mentioned earlier, that prevents conversion from T4 to T3. So if you're having problems taking a convert, like on your own, if you have conversion problems, you would not want to take propranolol, because it's just going to exacerbate that. And then, so I can't say specifically this is what you could take. And then especially when it comes to like if someone's on antidepressants or other medications, I would always say check with your medical doctor or check with a local pharmacist for interactions. So again, I mean, I will say most people could take the basics, like I recommend omega-3s, probiotics, and digestive enzymes. But then, I like to look at testing. I like to look, like if someone has adrenal, like do adrenal testing, and based on imbalances, give recommendations based on that. Give recommendations to reduce one's toxic load and support the gut. I mentioned already, like probiotics and digestive enzymes to support the gut. Someone asked about gut supplements, and I also mentioned L-glutamine, which I don't give to everybody. But yeah, I would. Again, not to plug my book, but I'll plug my free website, naturalendocrineconsultations.com, where I talk about different types of supplements. I mentioned black cumin earlier. Now, again, I don't think that interacts with antidepressants, but that's why, like off the top of my head, I don't think so, but I'd have to do research. And again, I would just ask pharmacists, even pharmacists. I learned this. I was chatting with a pharmacist, or I was like a phone call with a pharmacist and asking about different interactions. I was trying to find out, this was a few years ago, like certain interactions. And the pharmacist didn't know either. The pharmacist was like referring to their database and kept on putting me on hold, and admitted, she admitted that that's what she was doing. So it's not like they have all these things memorized, and neither do I. So if someone's on antidepressant, also depends on what specifically you would be taking. But like Black Human, again, maybe ask your um, or ask, well, I guess your medical doctor, the primary, whoever prescribed it, the prescribing doctor, but a pharmacist would also at least be able to find out that information. And read my book. Consider reading my book, Hashimoto's Triggers. It's if you get it, the Kindle version, it's $6. Of course, the print version is more, like, I don't know, probably like $18 to $20. Amazon just changes the pricing and all that. And yeah, so again, that's like Walt said, or I said first, and Walt confirmed that it is quite comprehensive. So I think will be a good $6 spent, or a good $18 to $20 on the hard copy. All right, I will get back to Zoom, but let's answer a few more questions here. And again, we have a good amount of questions on YouTube today. So Chudy, is it important to get anti-TPO down, and how to get it down? I like to get all the antibodies down over time. I mean, they could fluctuate, especially anti-TPO. Those thyroid peroxidase antibodies do have a tendency to fluctuate. And so, again, I would tune in to, I would look at actually today's episode on YouTube. Since you're on YouTube, visit my Natural Thyroid Doctor channel, this is where this is being live streamed to. And then listen to my interview where I have with Dr. Anshul Gupta, and we talk about different triggers of Graves and Hashimoto's. And so that's really what you want to do, address those triggers, heal the gut. He also talks about peptides as well. But yeah, so all antibodies, sometimes it's challenging. I can't say that I'm successful in everybody in normalizing antibodies, but that is one of the goals. All right, I'm going to answer this, then I'm going to go back to the Zoom. I should be able to get to YouTube one more time. Again, I'm going to go about another 20 minutes to like 3:15, and so, and again, I'm doing another one 8 p.m. on Thursday. But if you can't attend that, again, sign up, visit rapidthyroidhealing.com. Monday, May 9th, I'm going to have live calls every day. I'm rotating the times to accommodate those in different time zones. So again, I'll be answering questions then as well. But I don't know if I pronounced that right, so I apologize if I didn't. But I've had Hashimoto's for over 20 years. My T4 has always been elevated for some reason, and haven't been able to bring it down. My doctor always says that is so weird, but haven't really figured it out. It could be thyroid hormone resistance. Look at I do have an article on that, thyroid resistance, or just do a search, thyroid resist. Visit naturalendocrinesolutions.com, and then do a search on thyroid resistance or thyroid hormone resistance. And kind of like insulin resistance, you might have problems getting thyroid hormone into the cell. And there could be like zinc deficiency, vitamin A deficiency, even inflammation could be a factor. There could be, over the years, a good amount of inflammation. But that's what I would think if someone if their TSH is normal or elevated, yet their free T4 or T4 is high. I'm thinking like thyroid hormone resistance. All right, let's go back to Zoom. All right, so Heather, I'm down to 89 pounds. Any tricks to gaining weight? And then do you recommend Dr. Child's Hyperthyroid Kit? I found him through your podcast. I was checking it out last night. I mean, I can't say it's something I recommend, like where I tell people, where I tell my patients, go out and get his hyperthyroid kit. So I honestly forgot what's in his hyperthyroid kit. So I'm not sure. I don't remember. If you want to type in like what types of supplements that's fine. Again, I'm not sure. I don't think it has like things like bugleweed or anything like that. Probably things for, inflammation and gut support. But yeah, again, I completely forgot what's in this hyperthyroid kit. I looked at it before and I thought it was okay. No, I don't think anything wrong with it. Even though I'm not sure if it has. I know he does like during at least one of the episodes. I think it was the supplement one, which would make sense. We spoke about iodine, and I gave my perspective, and he gave his perspective. We're both not against iodine, but cautious about iodine. I think I'm a little bit more cautious these days. I was, more not as cautious years ago. But again, just don't remember if it has iodine in any of those. So if someone's trying to avoid iodine, I would just be worried. No, I'd be anyway, just maybe cautious, not worried or concerned. And then Heather, no bugleweed, adrenal support, vitamin D, omegas, probiotics. Yeah, I mean, vitamin D, omegas, probiotics that commonly give adrenal support. I like to do testing. So Dr. Childs, he's no longer practicing. Just I forgot why he explained. I think in the first interview, but just rattling feathers with conventional medical doctors and just having a lot of success just with his blog and YouTube channel and I think he has he has a podcast too, and just and also with the supplements and all that, he's doing pretty good. So he's so yeah, I don't, it's been a while since he's seen patients, but yeah. So anyway, just I would say, and I'm bringing that up just because he doesn't do testing because he's not seeing patients, but I like to do testing for adrenals and not just randomly give adrenal support. But it might be fine. So if it has ashwagandha, some people with hyperthyroidism don't do well with ashwagandha. Some people do fine though, and I have a podcast episode on that. Natalie, do you recommend turmeric supplements? I do like turmeric a lot. So yeah, I can't say I recommend turmeric supplements for everybody, but obviously turmeric is good for inflammation. All right, so I got a direct message here, and so I won't say the person's name, I guess, but I'll just read their question. So plant-based 50-year-old female with a history of high cholesterol in my non-vegan days. Oh, okay, that's okay. A person said, sorry, I meant to send it to everybody. Yeah, it's okay. I'm reading it out to everybody. So I sometimes people send a direct message and I don't know if it's some people accidentally send it as a direct message, but some people don't want, I guess, people to know their name, but I'm sure people don't care if I read out their question. But in your case, obviously you don't care because you accidentally sent it as a direct message. So plant-based 50-year-old female with a history of high cholesterol in my non-vegan days, was eating a lot of Brazil nuts to lower my blood cholesterol before a blood draw. And when the results came back, my thyroxine was high, so T4 was high, my TSH was low, my cholesterol was 153, but I credited it to the Brazil nuts. So I retook the blood draw a few months later. My T4 dropped down to 173, but TSH was still below normal. So they diagnosed me as having subclinical hyperthyroidism. I was having heart palpitations, muscle spasms, but started bugleweed and it helped a lot. Palpitations have subsided for the most part, but I still get anxious. I must say, within the past few years, I feel more stressed than normal, and I think my adrenals are overworked. Thoughts? So diet is pretty good and would be hard to avoid nightshades. Yeah, you might not need to avoid nightshades if you don't have Graves. So if yours isn't autoimmune, but yeah, subclinical hyperthyroidism sometimes can be tricky. If it's subclinical Graves disease, then it's still autoimmune. But if it's not autoimmune, then I mean, for people I work with subclinical hyperthyroidism without an autoimmune component, I'm focusing on diet a lot. So so it sounds like you're doing a good job with that. And then and hopefully, even though you're not avoiding nightshades, hopefully avoiding like gluten, at least, gluten, I would say dairy and corn. Like, some people think their diet's eating, they're eating like whole wheat pasta and things like that, which are not healthy. So but adrenals and stress seem to play a big role when it comes to subclinical hyperthyroidism. Again, in my experience, And, there could be other factors as well, like, increased toxin, like environmental toxins, playing a role. I mean, I'm glad the bugleweed helped. The only thing is you don't want to rely on the bugleweed, which is, I'm sure, why you bring this up as well. And, and like you said, you did say I feel more stressed than normal, and you think your adrenals are overworked. So I think you're kind of like answering your own question. You're already doing a lot with the diet, so the priority needs to be on stress management. And some people, the not, I don't want to say argument, but some people will be like, well, I just don't have time for stress management. And because I would tell someone to, I commonly tell patients, block out time daily, even if it's only 5 minutes. And still there'll be some people that say I just don't have the time. But if someone doesn't have the time for stress management, then they need to make it a priority if they don't have the time. Because that's same thing with me. I can relate with that too, because just I have a never ending to-do list, so I could easily say I don't have time for stress management because there's other things I need to do, which is true. There are other things I need to do. It's just a matter of prioritizing. So yeah, I would just become a stress management warrior, and yeah, it just says just need reassurance. Indeed, stress management my priority. Yeah, so I would do that. Maybe even consider getting adrenal saliva test done, or dried urine testing, also like Dutch test or adrenal saliva test. And Natalie, I'll answer your question, then I'll go back to YouTube, and I might have time to come back to Zoom. We'll see how many questions are on YouTube. So Natalie, I bought selenium 200 micrograms. Is this too much? Should I take it every other day or buy another lower dose one? Again, everyone's different, so I don't know how you will do on 200 micrograms, but 200 micrograms is a common dose. And again, tune into the podcast episode because I talk about dosing and selenium. So savemythyroid.com, click on podcast. So you do have to click on podcast, or go to Apple or Spotify, type in Save My Thyroid. And the very first episode you'll see will be selenium and thyroid autoimmunity. Again, it's like a little over 5 minutes to episode. So definitely check that out. Okay, so let me go back to YouTube. And again, I'm going to take another quick sip of water. So have you had any Graves patients taking bugleweed get severe chronic urticaria? Not due to taking bugleweed. I've had a few patients with that, but which I believe is also, I think also autoimmune too. But yeah, I haven't had it with the like I have not seen anything where bugleweed causes that. So I don't know if that's just a coincidence, if you did start taking bugleweed and you noticed that. Trudy, have you heard of Graves causing tinnitus, ringing of the ears? No. Yeah. I'm sorry. Yeah. 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 Actually, when I dealt with Graves, I had some mild tinnitus, like ringing in the ears, and it lasted a few months. And in my situation, it went away. So, there could be other, like viruses could be a trigger for hyperthyroidism, especially Graves. And I know with COVID, there's someone who I know who got, actually, no, I'm sorry. He actually, and I'm not trying to say anything bad. Like, I don't want to open up a can of worms with the vaccine, but he got the first the Pfizer vaccine, and then got the tinnitus. There's I'll say this with it, because again, I am kind of opening up a can of worms. There's risks either way, getting COVID or getting the vaccine. But he got the vaccine and he got tinnitus, so it wasn't actually the virus itself. So I'm trying to, but like I said, I got it and it went away, and that's the case with most people when it's due to the hyperthyroidism. If it's due to something else, like I brought his situation up because at first, initially, I thought it was due to the virus, but also it hasn't gone away, and it's been almost a year, and so she's still trying to figure it out. But most of the time, that's not the case when we're dealing with hyperthyroidism Graves. Thankfully, I've had other people experience it as well, and it seems like usually it resolves. Oh, actually, you know what, Heather, I forgot, I skipped over your question. like I got to what your hyperthyroid child's hyperthyroid kit, but the gaining weight trick, yeah. So I'll get back to YouTube in a minute, but I forgot to answer this. Yeah, I have a podcast episode. I have an article, I think a couple of articles on that. Gaining weight when dealing with hyperthyroidism is my article, and then I have one like maintaining a healthy weight as an article and podcast episode. You need to get those thyroid hormone levels down. So there's really no trick to gaining weight, but your levels are really high, and that's why your thyroid, and that's the number one thing I say when it comes to people wanting to gain weight. I lost 42 pounds when I was with hyperthyroidism, and there could be other things too, like having a healthy gut, but eating nutrient dense foods is not going to do much if you have really high elevated thyroid hormone levels. So yeah, check out the podcast, check out again my website for articles. But yeah, so like I said, that's really got to be the emphasis, just trying to get those thyroid hormone levels down. Yeah, you're welcome. I'm sorry, you asked two questions, so that's why I forgot, because I was like, the second one is, I'll just do the second one first, and then I forgot the first one. So, and Lori says, thank you so much for what you do. You are welcome. And you again, thanks everyone for for again supporting me. I appreciate it. So, and I'll say this: if one thing, just obviously, I usually don't do this. Sometimes I do, but again, if anybody has been keeping track of the podcast, and if you like it, please feel free to give a review. That's one of the things that encourages other people to listen to it. And there's people with hyperthyroidism that might come across the podcast and be like, I don't know, maybe I should just listen to another thyroid podcast, even though again, this is the only one I know of that really focuses on hyperthyroidism. But again, the reviews help, because people do look at reviews. And so if you enjoyed the podcast, please take like 2-3 minutes just to review it, because again, I guess you could say it'll benefit me because it's going to bring more people to the podcast. But the reason I want more people to come to the podcast is so they don't get radioactive iodine thyroid surgery, just because so many people are being pressured with hyperthyroidism when there are other solutions. So yeah, thanks, Heather. Thank you so much. Yeah, and definitely check out the podcast episodes and articles. All right, so let me get to YouTube and try to knock out. Again, if I don't get to every question, again, like I said, I'm doing another one of these, and then I'll be back for the week of the 9th. And yeah, definitely Heather and Lori and everyone with hyperthyroidism, definitely sign up for the challenge. And let's see. So okay, so Walt, I'm not sure. I know for women. So Walt asks, any idea what the normal ratio of estrogen to progesterone is for men? So, like, what you want more progesterone? Like, it's for what most of my patients are women, even though I'm one of the lucky ones with lucky men that develop Graves. But 30-1 is what I've heard. I don't pay much attention to the ratios, honestly, as much as I used to. Just try to get people. Like if we're doing like progesterone, like let's say a Dutch test, obviously we want to try to get the levels to healthy levels, and usually the ratios will kind of, I don't know any, even though like practitioners talk about ratios, I don't know if anybody really pays that much attention where they're going to give recommendations. Like, because let's say if we're having someone, improve sex hormones by optimizing adrenal health, again, the only way to look at, know if the ratios have improved is by, just continuously doing retesting. Now, maybe if someone is prescribing bioidentical hormones, you could, have more control, but probably those who do that probably aren't really as focused on the ratio itself. But yeah, I don't know what that ratio is for men. And like I said, I can't say spoke about it in the past more. I haven't spoken about it for years, just because when doing saliva testing, they talk about it. But then, well, the saliva testing, which again, I do more dried urine testing now. Saliva testing, the diagnostic solutions, or not, I'm sorry, diagnostics is the one for saliva testing, and their cycling hormone test. It gives like the ratio and yeah. Anyway, so I'm kind of like rambling here, but let's so Tanya George, 18 months ago, I had a medium levels of Graves antibodies, and now I'm negative. Does this mean I don't have Graves now and unlikely to relapse? All my levels are in range now, but yeah, I mean, it could be. I mean, if you did things to address the cause of the problem, then I mean, that's what I look for. If like you just spontaneously went into remission, then I mean, I still would be cautious. I mean, if someone takes anti-thyroid medication, they get into remission. Again, usually the antibodies won't normalize just with taking anti-thyroid medication. But if the cause was like, if you did things to address the cause, diet, lifestyle, other things, like adrenals, which falls into lifestyle too. But if all you did was, just like, let's say, take medication, or even if someone just take bugleweed but didn't do anything to address the cause of the problem, then, no guarantee there's going to be a relapse. But, I always would encourage people to do things to try to optimize their health. So B says, hello, Dr. Eric. Thank you so much for a very informative Q&A. Do you think that potentially there could be any link between Hashimoto's and skyrocketing prolactin levels for a non-nursing woman in her 30s? Yes, I do have an article on prolactin, and spoke about it also in my Hashimoto's Triggers book. But yeah, you definitely visit Natural Endocrine Solutions, do a search for prolactin. That could be a factor. And I talk about something like Chase Tree, I think, is one thing, also known as Vitex, that might be able to help. And but of course, you want to make sure, like, if someone has high prolactin levels, again, most of the time this isn't the case, but sometimes it could be like a pituitary adenoma. There could be something going on there. So definitely something to maybe get evaluated if you haven't already. But yeah, check out my article on naturalendocrinesolutions.com. All right. So Tronics World, is the medical community researching a cure for Hashimoto's? I mean, conventional medicine, probably not. So again, find, remove triggers, heal the gut. There is a genetic component, so I don't like using the word cure. But if you find, remove triggers, heal the gut, you could achieve a state of remission. And if to me, I've been in remission from Graves, which is also autoimmune like Hashimoto's, since 2009, and I feel like I've been cured. I'm cautious about using that because I know there is a chance I could relapse, and just hoping that day doesn't come where I have to like write an article or record a podcast about, my second battle. But again, it's been, 13 years. So I would have absolutely no regrets. I'll say that too. If I relapsed, I would never like think, oh, I should have just gotten the radioactive iodine thyroid surgery. If I relapse every 13 years, even every 10 years, and that's preventing me from getting, I mean, that's not ideal, but again, I still would take that. But hopefully I'll continue to stay in remission. And that's the goal. The medical community is probably not doing anything for cure, to cure it. They're usually looking for just medications if they're doing anything from an autoimmune perspective. And Walt says, fighting Hashimoto's, exploring every aspect. Thank you very much for taking my questions. You are welcome. Thanks again for checking out my book, and yeah, for attending this Q&A. And then Trudy, I've gained a lot of weight after been diagnosed with Graves. Do you know why? Thank you so much for answering my questions, listening from Norway. Actually, I just did an interview with Dr. Weston Childs about unwanted weight gain and hyperthyroidism and Hashimoto. So Hashimoto's, it's very common. Hyperthyroidism, again, a lot of people like myself and Heather has lost a lot of weight. But there are some people that, for whatever reason, gain weight. Now, if someone's taking anti-thyroid medication, that could cause someone to gain weight, but sometimes there are other factors. So check out that podcast episode. Again, if you visit savemythyroid.com and click on podcast, the most recent episode is a Q&A episode on selenium. And then the one right after that is the one on unwanted weight gain. So definitely check that out. And what am I? Yeah, and then I have another one, maintaining a healthy weight. So where I talk about, that's a solo episode. I talk about weight gain and weight loss. And Tanya, thank you. I followed Anthony Williams through thyroid healing and took lots of the supplements you've been talking about. And I was on carbinazole 40 milligrams daily and propranolol just for a month. Yeah, so yeah, 40 milligrams, that's a pretty high dose of that. And yeah, that's so that is odd that you only on that for one month. But yeah, just keep up the good work. Sounds like you did do some things, you took a lot of supplements and probably change your diet as well. So yeah, that's awesome. Just keep up the good work. And Judy, so yeah, anti-thyroid medication can cause people, yeah, I mean, that's the goal. So you're on 20 milligrams, which, is like a moderate dose. And yeah, that lowers thyroid hormone levels, lowers the metabolism. So yeah, that definitely can be, and a good chance that is a reason why you're gaining weight. All right, so I'm going to answer these next two questions and I'm going to call it a day because it's right now 3:18. So Laurie, if you eliminated the trigger foods, would that help to reverse Graves without supplements? It could, but oftentimes it's not just food that's the trigger. There's usually other triggers. So if it's just a food problem, yeah, like if someone is, if gluten is the only trigger, and if they eliminate gluten, yeah, you might not need to take supplements. Maybe to heal the gut, and even that you might be able to rely on foods. But problem is, it's usually not just food. So and I talk about that a lot. And I'm sure I'll talk about that during the Accelerated Thyroid Healing Challenge. So, and then this will be the last question. So Jean Marie says, what do you think about red light therapy? There seems to be some research on Hashimoto's and being effective, but it can be harmful for someone with Graves' disease. Any research on this? No research with Graves. And so I don't know if I would do it with, I guess thyroid, like I don't know if there's research on red light specific. There's like cold laser, which there's definitely some overlap. Like I wrote an article on cold laser, and there has been some research where it can help maybe with thyroid regeneration, lowering the antibodies it showed. So, so yeah, I like red light therapy. So, but yeah, for Graves, there's not really research, so I can't say, it's that. And either way, I would say you want to address the cause of the problem. Like that might be beneficial, but let's say if someone has an underlying infection, and then they put cold laser, let's say they use that on the thyroid, red light therapy, you still want to do things to address the cause. Same thing with the food, if someone has food triggers. So that might help with the healing process, but you still want to find, remove triggers, do things to heal the gut. But yeah, I do like red light therapy. For Graves, I'm not sure as far as if that would make things worse. My guess it probably wouldn't, but I don't know for sure. Natalie, thank you so much, Dr. Eric, for your time answering questions. You are welcome. And yeah, thank you so much. Cassandra, I do recommend bugleweed at times while people are on methimazole. Her question, can you take bugleweed while on methimazole? So I know I said that was the last questions, 2 questions I asked, but this is a quick question. So, but again, there's going to be more time for questions, either if you're available Thursday night, 8 p.m. Eastern time, or again, I'm going to be going live every day during the challenge that begins Monday, May 9th. And then there's 2 Q&A sessions May 13th. So, but you need to register because and there's no catch to register. Normally in the past, I have a VIP offer. I'm still debating whether I'll have that VIP offer, but that's completely optional. Right now, there's nothing out. I'll need to make a decision within the next few days, but pretty much I'm just doing it just because a few years ago I started doing these challenges. And again, just some people can't afford to work with a practitioner one-on-one, or again, it's just also nice just to teach, and just like I'm doing with this Q&A. So again, absolutely no obligation to join. And yeah, so everyone, thank you so much for attending. I appreciate your time on this Saturday. And Lori, you're welcome. Heather, you are welcome. Again, thank you both. And everybody, have a great rest of your weekend. Have a great, and again, thanks also to everybody, not just Lori and Heather. Again, I appreciate everyone attending, taking out time to ask questions, and including those both on Zoom and YouTube. And yeah, very impressed with YouTube. Zoom, I'm always impressed with, because people are always asking questions, but YouTube, sometimes there's only like 1 or 2 people. So we had a lot of people, a lot of engagement here on YouTube as well. So everyone, again, have a great rest of your weekend, and catch some of you maybe on Thursday night at 8 p.m. Eastern time. And then hopefully I'll catch everybody, not just those with hyperthyroidism, but those with any type of thyroid or autoimmune thyroid condition during the challenge the week of May 9th, because again, that is for everyone. So, all right, well, take care. And I forgot with Zoom. I got to stop the share. So, all right, everyone, take care. Again, have a great rest of your weekend.